Good evening. It really is a pleasure for me to be here with you today to celebrate the expansion of the work that UT Health Science Center San Antonio has been doing to improve the health of the population throughout the state of Texas. And the award of the ECHO Superhub status, being one of 7 entities across the United States that will be providing this service. So as I start, I want to give a big thanks to Dr. Joel Savat for his continued leadership and the work of the team. And also congratulate Dr. Wari Allison for the work in order to get this Superhub status established here in the state of Texas. What I want to do today is talk about health in Texas and why I think telementoring is so important if we want to really improve the health status of Texans across the state of Texas. Again, for those of you that do not know me, my name is David Lakey. I'm the Vice Chancellor for Health Affairs and Chief Medical Officer here at the University of Texas System. And I had the privilege of serving for 8 years as the Commissioner of Health for the state of Texas. One of the things that I learned when I was the Commissioner of Health here in the state of Texas is that health is complicated here in Texas. That there are several things that come into play as we try to describe health in Texas. One of the entities that tries to be objective in ranking states related to health status is the United Health Foundation through its American Health Rankings. Back in 2019, they ranked Texas 34th in the nation. And if you look at the history of these rankings, Texas is always ranked somewhere between 40 and 30. We've really not broken that 30 ranking level ever in the history of these rankings. Let me tell you a little bit about how they do this ranking, because I think it's important as we understand health and the role that ECHO can play to improve health here in the state of Texas. They have a model where they look at several factors to really gauge health in each state. They look at the social factors, social economic factors, and when they look at those, that part of the composite score, Texas scores about 33. They look at the overall physical environment, whether how the air, the water is, the housing, climate change policies, and related to those factors, Texas ranks 43rd. If we look at behaviors, we do better. We have fewer individuals that are smoking, but we have challenges related to physical activity. And when you look at all those components, that part of the composite score, we rank 29. And in health outcomes, we seem to outperform. We rank about 22nd in the nation. The area that we fall behind is this clinical care component. And let me talk through the clinical care component of this ranking score. So here is the different components of the clinical care ranking. And if you look at the very top line, according to this objective analysis, Texas would rank 50th in the United States related to the clinical care. Why do we rank so low? Part of it has to do with access. Big part of that has to do with leading the nation in uninsured. We're 50th in the nation in the uninsured. But another part that I want to draw your attention to is the number of providers that we have here in the state of Texas. If you look at the number of mental health providers, we're 49th. The primary care providers per capita, we're 47th. If you look at a variety of other components in this part of the composite score related to screening for colorectal cancer, and a variety of other things, we're falling behind the rest of the nation. And I think, again, this is why Project ECHO can be very important as we reach out to rural communities in our state. Another set of analysis is the community health rankings. And community health rankings is an analysis by the Robert Wood Johnson Foundation, coupled with the University of Washington and their School of Public Health, the University of Wisconsin and their School of Public Health, where they analyze county by county the health status of the individuals in those counties. They look at 2 main components, health factors and health outcomes. In their model, they weight different parts of the health factors a little differently. It's very similar to the America's Health Rankings when they look at the physical environment, the social and economic factors, clinical care, and the behaviors that are very important for individuals in order to be healthy: tobacco use, diet, alcohol, sexual activity. But in the clinical care component, it's about 20% of the county health ranking score, and they look at access to care and the quality of care that individuals receive. I've been looking at this data for over a decade, and it looks pretty much the same over that decade, that there's significant disparities in health outcomes, whether you look at health factors or health outcomes here in the state of Texas. The picture is very clear to me that health factors are very different in East Texas and South Texas, the rural parts of our state, and other areas that in West Texas that are more rural. If you look at health outcomes, the picture is very similar. Health outcomes may be a little bit better in South Texas than East Texas, but the rural parts of our state really are falling behind the more urban areas related to health outcomes. And that's predicated upon the health factors that occur in those areas. I have a large kind of paragraph that I pulled out of a report from the Texas Department of Agriculture, which I think really shows the challenges that we have related to rural health care here in the state of Texas. This report was the Texas Rural Health and Economic Development Advisory Council's report, came out about 3 years ago, December of 2018. And I don't want to read the whole paragraph, but a couple of components of this I think would be very, I find very enlightening related to health here in the state of Texas. The first part of this, the first sentence that I've highlighted, that geographic isolation, a critical lack of physicians and specialty providers, hospital solvency, and social economic factors create considerable barriers for rural residents to receive adequate health care services. And again, this is the Department of Agriculture has identified that the lack of physicians and specialty providers really is a major challenge here in the state of Texas. They go on to explain how important this is. 84% of Texas's land mass is rural, and in those areas, there's expansive distances in order to receive health care here in the state. You know, these areas are the areas that provide us our food, our fuel, and our fiber that are really important for the state of Texas. And that about 177 counties are rural or non-metropolitan areas out of the 254 counties that we have here in the state of Texas. And they note that an overwhelming majority of rural hospitals are located in one of these states' 139 federally designated health professional shortage areas and the medical underserved areas, 111 of those. They measured by significant both provider shortages and adverse health outcomes. And that 63 Texas counties do not have any hospital, and 35 counties do not even have a primary care provider, a physician. So a couple of pictures that I want to show you related to that shortage of healthcare providers in the state of Texas that I think are important as we understand the importance of Project ECHO, especially being a Superhub related to Project ECHO. This is data from HRSA, a federal agency that looks at health resources and services challenges and resources in the United States. In the state of Texas, 223 of our 254 counties are health professional shortage areas. And there's 13 additional counties that are partial health professional shortage areas in that designation. And this is recent data as of spring of this year. If you look down in San Antonio, you can see that Bexar County is one of those areas that is a partial HPSA area. There was another report from the Department of State Health Services that came out about a year ago where they looked at physician supply and demand, and they looked at the predicted shortage that we should see by 2032. And this demand is going to increase, and the shortages are going to increase throughout the next decade. That Texas ranks 41st among the 50 states in the number of active physicians per 100,000. And this is only going to get worse related because of the aging of the population and the population growth that we are experiencing in the state of Texas. Not only do we have a shortage in primary care providers, but we have a significant challenge related to mental health providers in the state of Texas. And if we look at mental health providers, 246 of our 254 counties are mental health HPSA areas. So that's for primary care providers, physicians as a whole. National data tells us that if we look and drill down and look at subspecialists, it's even worse, even a greater challenge related to the coverage of subspecialist physicians in these rural areas. That in rural areas, if you look at the number of physicians per 10,000, look at primary care physicians. In urban areas, you have 31 per 10,000. In rural areas, it's almost less than a third of that, 13 per 10,000 people. And then if we look at our specialists, in urban areas, they concentrate in the urban areas. So we have 263 per 100,000 versus 30 per 100,000 in the rural areas. And so not only in rural areas do we have fewer primary care providers, but they have fewer subspecialists to provide them the support they need in order to provide the services that they need to care for the patients that they're serving. And so those individuals, if they want those subspecialty services, many times have to drive many, many hours away, in Texas, hundreds of miles away sometimes, to urban areas to get the care that they need. That Department of State Health Services study that I referred to earlier, looking at the projections by 2032, they would say that we only have about 72% of the cardiologists that we're going to need statewide, 72% of the endocrinologists, 62% of the infectious disease physicians statewide. Again, those are statewide numbers. If you start drilling down to rural areas, that gap in the provider base gets even worse. So several years ago, we pulled together a group of people like Dr. Savat at UT Health Science Center in San Antonio to work with us to figure out what we could do within the University of Texas system to improve population health. And we pulled together all of our health components. And again, high-level individuals, people that were very experienced in public health and population health improvement, to think with us, what could we do in order to maximize the impact of the University of Texas system in improving health for the people we serve? After working together for several years, we pulled together a strategic plan in the 2019. We released it in January of 2019 to really concentrate our effort on several really important initiatives that could improve health for the Texas population. So let me talk through that and then bring it around to why I think it really focuses the importance of the work that you are doing. So in this strategic plan, we identified 6 objectives that we thought were really important. One is that we needed to start working together better. Instead of being isolated in our health science centers, we needed to collaborate across our centers to really work together to improve the health of the population. We also noted that we needed to develop strategies to promote data sharing, the repository use, and analytics to get smarter with data. I'm going to come back to number 3 in a second, because this is where Project Echo and telementoring falls in. Number 4 was to promote cancer prevention and screening. We also saw a need to really make a major effort to improve mental health services in the state of Texas. And finally, to work together to advance health and healthcare workforce development in the state of Texas. But number 3 was to increase the use and reach of telemedicine for delivery of primary and secondary care. So let me tell you a little bit more about our thoughts related to how the University of Texas system and the state of Texas could move forward related to with telemedicine, and I would say also telementoring, and why that's important here in Texas. So as we noted, there were several things that we needed to do to improve telemedicine for the delivery of primary and secondary care. To increase the telemedicine, our objectives were to increase telemedicine to address health disparities and gaps, identify and address community telemedicine use and acceptability to ensure the reach and acceptance of telehealth, and to provide providers and clinical leadership to advance the use of telemedicine and telementoring across Texas. Again, we thought it was such importance to expand the ability to help our rural healthcare providers and other primary care providers that need some coaching in order to provide the level of care that they can provide in their community. To really expand the knowledge and make knowledge travel versus having patients travel to get their care. And we need to develop and maintain telemedicine technology to address population health priorities, including the collection of data to evaluate the reach and implementation of our programs. Furthermore, as we worked through this, we identified different methods to achieve these goals, and want to highlight that one of the areas that we thought was really important was to identify opportunities to use a Project Echo model for telementoring for additional specialties in the state. So I think there's a large opportunity here to really leverage telementoring to improve the availability of healthcare in the state of Texas. And let me just give you some examples of specific areas that using this technology, we can make major advances. First, in cancer, MD Anderson is also a Project Echo Superhub. They've identified several areas that they can leverage their talent in cancer to help rural communities, border communities, related to cancer prevention and cancer care, whether it's cervical cancer screening, tobacco cessation, counseling primary care providers of how can you be better at addressing tobacco use in your population, helping with institutions related to survivorship. How do we care for individuals after they have they fought their battle with cancer, have survived, but have ongoing health conditions? How do we address those health conditions? And how do we provide better palliative care? Again, several concrete areas that they've been able to leverage in order to improve health services in Texas. Project Echo was built on hepatitis C. In 2003, the first major effort was on hepatitis C, when there was a realization that many individuals were delaying their care for hepatitis C because they couldn't come in and see a subspecialist because of the travel or scheduling, and the good data that showed that when they were able to provide telementoring to primary care providers, that the outcomes were just as good as individuals that ended up seeing the subspecialist. UT Health Science Center San Antonio has been doing work in hepatitis C in South Texas. I think there's opportunity to do more of that. I think there's changes that are taking place right now related to Medicaid reimbursement that will expand our opportunities to think differently about hepatitis C instead of just where we were several years ago, of kind of salvage care for people that had advanced disease, and think about this as an infectious disease that we want to eradicate. In order to do that, we need to do better at screening individuals, treating individuals, and expanding that provider base that will be caring for individuals with hepatitis C. HIV, I think, is another model where we can improve care in rural areas. That rural areas are not immune from HIV. And many a times people do not travel. They do not want to travel to a major urban area to get the HIV care. HIV care has become much more simple over the last decade. 15 years ago, we were treating individuals with 3 different medicines, 3 different pills multiple times during the day. We now have single pills taken once a day when they are administered through a clinician that knows how to take care of HIV. And so they know how to monitor individuals, care for them, watch their medications. And we're not going to be able to get infectious disease physicians and hepatologists or other types of physicians to move out to these rural areas. And so through Project Echo, we can provide the support we need to guide primary care providers in the care of hepatitis C and HIV. We're doing a lot of work in mental health. Dr. Steve Plitzka, I've been able to work with him for several years through our Texas Child Mental Health Care Consortium. And one of the projects that he's doing is our Child Psychiatric Access Network, where they're providing consultative services to primary care providers, pediatricians, family medicine doctors in the care of children with mental health issues. I think we need to do more of that. We need to do more of that in the perinatal area and also in to address adult mental health issues better here in the state of Texas. Pain management is also one of those opportunities that we need to address, that there obviously has been major challenge nationwide related to opioids, a lot of individuals that need better management of their pain, and especially in rural areas, finding somebody that's expert in that area is hard. And so equipping our primary care providers so they can manage that pain better really can improve the health of those individuals. And I have several other items here listed, whether it's geriatrics, sickle cell disease, helping surgeons provide the care that they can in the community, or to address rare pediatric diseases. All of these can be improved substantially by providing telementoring through Project ECHO type initiatives. And I say at the very bottom, and many more. You know, the last time I looked, over 65 different diseases had a Project ECHO format to address them somewhere in the United States. And I think that's now incumbent upon us to figure out what are some of these other areas that we need to really develop Project ECHO projects on in order to address these really important issues that are really hard to get addressed in rural Texas. My last slide, I brought up the triple aim, and I know people in the audience are very familiar with the triple aim. But for those of you that are not, this was developed by the Institute for Healthcare Improvement as an approach to improve health systems by looking at three simultaneous goals. That we need to improve the individual care experience for individuals, we need to improve the health of populations, and we need to reduce the per capita cost of healthcare. And I would say that Project ECHO and telementoring really fits nicely into this triple aim, because as we are able to equip primary care providers to care for individuals with a variety of needs, we're able to keep those individuals from having to drive all the way to a major urban area, as we're able to shorten that wait time to get the care that they need, we will in many ways fulfill all three components of this triple aim. So thank you for the work that you're doing. Thank you for the work that you've done over the last several years to provide the platform to secure this Superhub status with Project ECHO. And again, I think it will make a major impact in the health of Texans and the work that we're trying to do here in the state of Texas. So thank you for your time.